Minnesota is recognized for 1 minute.
Thank you, Mr. Speaker. Thank you also to the gentleman from Texas. This is a bill that is changing the course of American history, and it is why we need to repeal this bill today. I believe, Madam Speaker, that we will see this bill ultimately repealed. Why? Because it is women who will be hurt under this bill. It is senior citizens who will be hurt under this bill. And it's little vulnerable children who will be hurt under this bill, as well as families, as well as employers. All of America is at the cusp of being negatively impacted. Just one example. This bill was sold out of compassion. We wanted people with pre-existing conditions to find care, but the reality is less than 1% of those with pre-existing conditions were able to receive the assistance when the door was slammed shut. Why? We ran out of money. That's what Obamacare has delivered, a lot of promises that can't be fulfilled. Before we go forward with this train wreck, let's make sure it ends so we can bring about cures, we can bring about better developments in health care. That's what we want, health care for American citizens. And I yield back.
The gentlelady's time has expired. The gentleman from Michigan is recognized.
How much time do I have?
The gentleman from Michigan has 2.5 minutes remaining. And the gentleman from Texas has 2 3/4 minutes remaining.
I yield myself the balance of my time.
The gentleman is recognized.
You know, I'm from Michigan. 75 years ago, a predecessor brought forth ideas at long last we would lift the shame of millions of Americans who go to bed without health care. Since that time, the numbers have grown. Today, over 50 million. There's a reference to children. How many children today go to bed without a stitch of health care? Millions. Women, how many women today go to bed without any health care coverage? We provided for seniors, and we have so far left most everybody out who needs some health care. And someone has the nerve to come forth and say there isn't enough money to implement when Republicans won't provide that money. Someone comes forth here and says there isn't the money to cover those with pre-existing conditions, and Republicans won't provide the money to provide further help for those people. You talk about repeal and replace. The disgrace here is you're fixed on repeal and never have come forth to satisfy the needs and the conscience of the people of this country. That's a disgrace. This bill is a disgrace. The Republican conduct on this has been disgraceful. I yield the balance of my time.
The gentleman yields back the balance of his time. The gentleman from Texas is recognized.
I yield myself as much time as I may consume.
Without
What's
objection.
Disgraceful is this thousands of pages of bill were rushed through this Congress with little chance to read it, laden with special interest provisions to buy off votes. And while the promises were made to the American people that their costs would go down, they could keep their plan if they liked, the economy would boom, none of it happened. And Republicans were denied even one vote on the House floor to provide a real alternative. That's the disgrace. Today, health care costs are going up. Independent experts say it could double in some states. And workers are finding out they can't keep the plan at work, that they'll be forced into exchange. And who can afford more expensive health care? Almost 2 out of 3 small businesses aren't hiring because of this legislation. I toured a pallet plant in Conroe where the cost of Obamacare is so high, it's equivalent of building 2 new plants and hiring 100 new workers. That won't happen. Local businesses are cutting jobs and cutting hours. One restaurant owner in Houston told their managers they will not hire another full-time worker, period. Obamacare simply makes it too expensive. And when these concerns are voiced, what Democrats in Congress and the President say is, it's the law. Get over it. Just get over it. Well, the bottom line is we're fighting to repeal Obamacare because it'll hurt too many patients, too many people, too many families, and bad laws should be stopped early before people get hurt. Year in and year out, we've wrestled with this Medicare formula to reimburse doctors. We've got it wrong, and doctors and seniors are being hurt. The alternative minimum tax has been a mess for years. The death tax as well. Can you imagine how much pain we would have avoided if these bad laws had been stopped early before they hurt so many Americans? Make no doubt about it, we needed health reform, but the President and Washington Democrats got it wrong. So let's repeal it now and replace it with real reforms that help patients, that help families, that help small business. Let's get government out of the office room. Let's give patients real choices. Let's lower health care because Obamacare, this Affordable Care Act, has failed on all of its promises. Madam Speaker, I yield back.
The gentleman yields back. All time for debate has expired. Pursuant to House Resolution 215, the previous question is ordered on the bill as amended. The question is on engrossment and third reading of the bill. Those in favor say aye. Those opposed, no. The ayes have it. Third reading.
A bill to repeal the Patient Protection and Affordable Care Act and health care-related provisions and the Health Care and Education Reconciliation Act of 2010.
For what purpose does the gentlelady from California seek recognition?
Madam Speaker, I have a motion to recommit at the desk.
Is the gentlewoman opposed to the bill?
I am.
The gentlewoman qualifies. The clerk will report the motion.
Mrs. Capps of California moves to recommit the bill, H.R. 45, to the Committee on Energy and Commerce, Ways and Means, and Education and Workforce, with instructions to report the same back to the House forthwith with the following amendment. Add at the end of the bill the following new section. Section 3, preserving certain patient benefit protections for women and their families as guaranteed under current law. A, in general, Section 1 shall not apply with respect to the ACA Women and Families Patient Benefit Protection provisions described in subsection B until such date that all group health plans and health insurance issuers provide equivalent protections for women and their families as provided under all such provisions. B, ACA Women and Families Patient Benefit Protection provisions. For purposes of subsection A, ACA Women and Families Patient Benefit Protection provisions described in this subsection are the following, as such provisions would be in effect before application of Section 1. 1. Preventative health services coverage without sharing. Section 2713 of the Public Health Service Act 42 U.S.C. 300 GG-13 relating to the coverage of preventative health services without cost sharing, including well woman, preventative care visits, breast cancer screening, mammogram, screening for gestational diabetes, and screening for interpersonal and domestic violence. 2. Coverage for individuals with pre-existing conditions. Section 1101 of the Patient Protection and Affordable Care Act, 42 U.S.C. 18001, relating to immediate access to insurance for uninsured individuals with a pre-existing condition. 3. Ensuring that consumers receive value for their premium payments. Section 2718 of the Public Health Service Act, 42 U.S.C. 300 GG-18, relating to the use of health insurance premiums primarily for health benefits rather than the administrative costs of insurance companies, including executive salaries and compensation. 4. No lifetime or annual limits. Section 2711 of the Public Health Service Act, 42 U.S.C. 300 GG-11, relating to no lifetime or annual limits. 5. Prohibition on pre-existing condition exclusions for children. Section 2704 of the Public Health Service Act, 42 U.S.C. 300 GG-3, relating to the prohibition of pre-existing condition exclusions or other discrimination based on health status, insofar as such section applies to enrollees who are under 19 years of age. 6. Coverage of adult children until age 26. Section 2714 of the Public Health Service Act 42 U.S.C. 300 GG-14 relating to the extension of dependent coverage for adult children until age 26.
Pursuant to the rule, the gentlewoman from California is recognized for 5 minutes in support of her motion.
Thank you, Madam Speaker. I rise today to offer the final and the only amendment to this bill. And I want to be clear, passage of this amendment will not prevent the passage of the underlying bill. If it's adopted, my amendment will be incorporated into the bill and the bill will be immediately voted upon. My amendment would simply ensure that women and families do not lose the benefits they have already gained from Obamacare in the event that the law is repealed. These benefits are critical to keeping families healthy and identifying problems when they are easier and less costly to treat. Benefits like the ability to get preventive health services without any copays. Thanks to Obamacare, no longer must women put off critical screenings like mammograms or colonoscopies because of the cost. And women are now able to be screened for domestic violence, for gestational diabetes, and receive other preventive care without worrying whether they can pay for it. Millions of us have taken advantage of these potentially life-saving screenings. Similarly, young adults, the most uninsured age group in our country, now have the option of staying on their parents' insurance plan until they are 26. This is a real benefit, one that has already enabled 6.6 million young adults to keep their health insurance coverage as they begin to make their way in life. On top of these benefits, we now have protections from some of the most abusive insurance company practices. For example, no longer can insurance companies cut off your care just because you are too expensive to treat. For too long, individuals who paid their premiums and followed the rules would still be cut off after hitting arbitrary lifetime or annual caps on coverage. These are our friends. They're our neighbors who did nothing wrong. They just got sick or had a tragic accident. And now they are protected, knowing their insurance coverage will be there when they need it. In addition, mothers no longer have to worry that their children with a pre-existing condition like autism or asthma will be denied health care. And starting this January, no American will be told that they cannot get coverage due to a pre-existing condition. Now, all of these benefits have been secured while holding insurance companies accountable to use your premium dollars on actual health care, not on bonuses or advertising. And all of these protections have been and would continue to be there for American families if my amendment passes. You truly do not realize the importance of these protections until you or someone you love needs them. And that is exactly the case of Victoria Strong. She's a young mother living in my hometown of Santa Barbara, California. Victoria's daughter, Gwendolyn, was diagnosed with a rare, extremely expensive disease when she was 6 months old. And despite the fact that she and her husband Bill had a good health insurance policy, one they paid thousands of dollars for each month, Victoria lived in constant fear that Gwendolyn would reach her lifetime policy limit before she even reached 2nd grade. And because of her pre-existing condition, Gwendolyn would then be uninsurable for the rest of her life. I cannot imagine how difficult it was for young Victoria to know that her child's basic health care needs would be covered, not even to know whether they would be covered or not in the future. And that's exactly what so many mothers faced before Obamacare. But the elimination of lifetime caps on care has given Victoria peace of mind. And it's done the same for millions of mothers across this nation. That's exactly what Obamacare is all about. Fixing our broken health care system. Fixing it for families like the Strong family. For women across this country, for their families, this law gets it right. And now we have one last vote to at least preserve the rights they already have. I believe that all Americans would be better off if we in Congress work to ensure swift implementation of the law instead of wasting time and taxpayer dollars debating repeal for yet the 37th time. But I think we can all agree that taking away existing insurance protections from everyday Americans is the wrong thing to do just because we are setting out to repeal. I remember the numerous hearings and markups about this law, and there was great agreement on both sides of the aisle that these consumer protections were critical to improving our broken health care system. So no matter what you think of this bill, my amendment would guarantee that no American family loses the care they have paid for now just when they need it the most. The law provides legal protection and peace of mind to the Strong family in Santa Barbara, but to all the families like them across our nation. Our families need this law.
The gentlelady's time.
And if the majority is willing to vote for the 37th time to repeal it, they at least need to vote on this amendment.
The
I urge my
gentlewoman's
colleagues
time
to vote yes,
has
and I yield back.
expired. For what purpose does the gentlelady seek recognition?
I rise in opposition to the motion to recommit.
The gentlelady is recognized for 5 minutes.
Thank you, Madam Speaker. My colleagues on the other side of the aisle can try as much as they would like today to distract the people from the real issue at hand. But the fact remains today that Obamacare was bad policy when it was enacted, and it's getting worse the closer we get to its implementation. When I hear from Hoosiers in the state of Indiana, from business owners trying to run companies to seniors seeking quality care options, I hear overwhelming uncertainty and concern, and Obamacare is the driving force. To protect Americans from this impending train wreck, I support full repeal of this law, which has been nothing more than a string of broken promises. Let's just quickly look at a few. Broken promise number one, the President claimed that he would not sign a plan that adds one dime to our deficits. However, the nonpartisan Congressional Budget Office estimated that this bill adds almost $2 trillion to that. After consecutive trillion-dollar deficits, our national debt is soaring towards $17 trillion. It's time to stop spending money we simply don't have. Broken promise number two, the President claimed that no family making less than $250,000 a year will see their taxes increase. However, the Joint Committee on Taxation reports that Obamacare includes 21 new or higher taxes that will cost taxpayers roughly $1.1 trillion. I recently had the chance to tour an orthopedic industry in my district in Mishawaka, Indiana. During this visit, I heard real-life stories from real-life employees about the taxes in Obamacare. I was warned that the new medical device tax will prevent the company from creating good-paying jobs in Indiana for Hoosiers who are out of work. The reality is this tax will increase the cost of medical devices used by our senior citizens and our wounded warriors. Broken promise number three. The President repeatedly claimed that his proposal could save families $2,500 a year in health care premiums, when in fact researchers from the Kaiser Family Foundation found that average family premiums have instead increased by over $3,000 since 2008. If not repealed, this law will continue to increase premiums and eat away at the paychecks of single moms and young families all across the country. The reality is, Madam Speaker, this Affordable Care Act is not so affordable. Broken promise number four. The President claimed he'd protect Medicare, but instead of protecting Medicare and making it stronger, he raided $716 billion from the program to fund his government takeover of our health. Millions of seniors who depend on Medicare deserve better. My mom, a Medicare beneficiary, deserves better. Madam Speaker, we don't need this law, period. We don't need a law that tramples over our freedoms by allowing the government to make our personal health care choices. We don't need a law that restricts our access to quality and affordable health care. And we definitely don't need a law enforced by an agency actively targeting citizens with opposing political views. I urge all my colleagues to defeat the motion to recommit and stand today and repeal Obamacare, and I yield back the balance of my time.
The gentlelady yields back the balance of her time. Without objection, the previous question is ordered on the motion to recommit. The question is on the motion. Those in favor say aye. Those opposed, no. The noes have it. The
Madam
motion
Chair,
is not
Mr.
agreed
Speaker,
to.
Madam Speaker,
For
I
what
ask
purpose
for a
does the
recorded vote.
gentlelady seek recognition?
I ask for a recorded vote, Madam Speaker.
The gentlelady asks for the yeas and nays. The yeas and nays are requested. Those favoring a vote by the yeas and nays will rise. A sufficient number having risen, the yeas and nays are ordered. Members will record their votes by electronic device. Pursuant to Clause 9 of Rule 20, the Chair will reduce to 5 minutes the minimum time for any recorded electronic vote on the question of passage.
For the past 3 hours or so, the House has been debating the repeal of the 2010 health care law, the Affordable Care Act, called by Obamacare by some. This 15-minute vote is the Democratic motion to commit. Democrats seeking to preserve benefits of the Affordable Care Act for women and children by excluding from repeal a number of elements in the law. This is a 15-minute vote. Final passage vote is coming up next. During this vote, we're going to open up our phone lines and see what you have to think about the health care law and whether or not it should be repealed. Here's how to participate. If you're a Democrat, the number to use is 202-585-3885. For Republicans, that's 202-585-3886. All others, that's 202-585-3887. Make sure that you mute your television when you call in. We'll get to your calls momentarily. We'll also check our Facebook page. We've had the poll up pretty much throughout the day. We'll check that, and Twitter as well. But before we get to calls, some background on what's at stake with a Capitol Hill reporter. Joining us is Mary Agnes Carey, senior correspondent at Kaiser Health News. Why are House Republicans eager to have another vote to repeal the 2010 health care law?
Well, it's no secret that House Republicans hate this law. Speaker Boehner just had a news conference today where he was talking about the law, how he feels it does damage to the economy, it's bad for patients, it's bad for the health care system. And last week he spoke about how 70 new members, 70 new Republicans in the House have not had the opportunity to vote on the president's health law, and they've been asking for that, and he wants to give it to them. In that briefing you mentioned he was also asked about any Republican efforts to replace the health care law. Did he mention any movement in that front? He said a couple of things. He said that he expects the House Republican Conference to talk in coming weeks and talk about what a replacement legislation would look like, and he also told a reporter, we'll let you know when we're ready to have a future vote. But he also talked about some of the legislation that Republicans have advanced before, and they certainly could advance it again. For example, legislation that would overhaul the current medical malpractice law system, allowing insurance to be sold across state lines. That's a Republican favorite. And also expanding something called a high-risk pool where people who can't get insurance in the market could go for coverage. So you could see those elements reemerge. How are Democrats responding to this effort, the latest effort to repeal all or a portion of the health care law of 2010? Kind of with a big collective yawn. I think Nancy Pelosi yesterday was saying, you know, which vote is it and how many times have they done this? And, of course, while this is the first repeal vote in this Congress, on 36 different occasions the House has voted to repeal or defund all or part of the law, and that was in the last Congress. So this has been a reoccurring theme, but I think Republicans think it works for them. It works on the campaign trail. Many Republicans have campaigned against the health care law, either current new members or current members, and they feel that this is really a winner for them, especially as they look towards the 2014 elections. Well, is the law fully in effect today? No, parts of it are and parts are not. And the key thing here to think about why they would look at repeal again is two major provisions go into effect next January. That is the health insurance exchanges, these online marketplaces where people can start to purchase coverage this fall that go into effect on January the 1st of next year, and also a Medicaid expansion. And together, those two would add tens of millions of people to the health care system. So once those are in effect, it might be even harder for Republicans to repeal the law. Speaker Boehner in his briefing today was accompanied by a prop, that 7-foot-tall tower of red tape. What are you hearing about from folks in the healthcare industry about the law's requirements and regulations? What I'm hearing is they're having a hard time figuring it out. This is a major expansion of, for the example, talking about the insurance exchanges and Medicaid specifically. Those are two huge changes to the health care law, and employers also have some new responsibilities on benefits they have to cover, and they're just trying to get guidance from the government, and some of that has been published and more is forthcoming. And to be fair, federal officials have made, I think, all of their deadlines so far in implementing the health care law, but the thing I hear the most is people are simply confused about it, and this was what Senate Finance Committee Chairman Max Baucus was talking about a few weeks ago to Secretary Sebelius, that's Kathleen Sebelius, who runs the Department of Health and Human Services, which is overseeing the implementation. He was saying his folks back home in Montana are very confused about the health care law, and he went as far as to say he sees a train wreck coming in implementation. So there are concerns among Republicans and Democrats on the implementation process, but I think many people are just trying to figure out what it means for them.
A look at the debate in the House on the health care repeal bill with Mary Agnes Carey, senior correspondent at Kaiser Health News. Thanks for joining us.
Thanks for having me.
And right now, this is the motion to recommit vote. One last chance to change the bill before final passage. A final vote is next on repealing the 2010 health care law. This would be the third attempt by House Republicans to do so. Let's go to phones. Julie is in Apache Junction, Arizona. She's on our Republican line. Julie, go ahead. You get the first comment.
Hi.
Hi, you're on the air.
Yeah. I'm hoping that the Republicans can repeal the Affordable Care Act law. I don't like the way that it was passed in the first place when Nancy Pelosi said that we got to pass it to see what is in it. My brother has a business, and it will affect his company. And, you know, I just hope that the Republicans can do it this time.
Let's go to our Democrats line. Portland, Oregon. Sean, welcome to the conversation.
Thank you. I say hurrah for the Affordable Care Act. I love my country. If my taxes go up, so be it. I want everybody to be covered. I believe that the House Republicans hate this law. I believe that the House Republicans hate President Obama. They do not have a plan, and they do not seem to know who won the election. Thank you so much.
Independent line is next. Atlanta, Maryland. Austin, go ahead.
Thank you. Thank you very much. And I want the healthcare promulgated by Obama to stay. Everybody talking about repeal, that shows me how much ignorant, how much academically lame and imbalanced most of the Republicans and most of the Congress people whom I thought they are intelligent. They don't go out to see people who voted for them. Some of them who cannot even afford going to the hospital, getting medication, or going to any to cure themselves with so many diseases and cancerous infections or diseases which they cannot cure. The children who cannot, even through their own mother's care, they can't have affordable medication. They don't go through all this, and when they want to vote, they will ask all these people to vote for them. How many of them and their children cannot go to the doctor?
We're asking people about the 2010 health care law, whether it should be repealed. This is the third attempt by the House Republicans to repeal the law passed in 2010. CQ writes that after scuttling a vote on the bill last month that would have extended part of the 2010 health care law, House Republican leaders say they're holding this third vote on legislation that would repeal the entire statute. Speaker Boehner saying that the 70 new House Republicans asked for a chance to go on the record about the law. Some of what's being said on Facebook. David said, kilo hacks on both sides are derailing the debate. It's time to stop listening to the hacks. Karen saying, I'm watching a Democrat regarding money spent on repealing Obamacare. Well, why didn't the liberals take the taxpayer money they dumped into green energy companies and take care of the American people that they now care so much about? Karen says, has anyone else noticed that the GOP dropped their talking point about the individual mandate ever since Romney became their candidate last year? Back to calls to Thurman in Lakewood, New Jersey, Republican line.
Yes, I'm very serious about it. It should be repealed. It should not be something that the IRS or even the administration should be involved in. It has really little to do with health care. It really has redistribution written all over it, namely take the money from individuals that are working and redistribute it as if it were another welfare, call it any other type of redistribution. It should not be something that a third party should get involved in. It should be strictly left up to the patient and the doctor. If they wish the patient to buy insurance, that's up to him. But keep the government out of the distribution of health care. It has become almost as bad as food stamps. It's almost as bad as the educational system. The government does not belong involved in health care in any sense.
On another related issue, The Hill reports today the administration wants higher standards for federally funded child care. A proposed rule from the Department of Health and Human Services was issued today that would strengthen standards for the 1.6 million children who are served by providers that get money from the Child Care and Development Fund. To Wiley, Texas, next independent line. This is Samuel. Hey there.
Hey, how are you?
Doing fine.
Thanks for letting me speak on your program. I think the American voters are getting more confused about what the Republicans are doing today in this country. First and foremost, you have a Congress, a Senate, and the Supreme Court that say this is the law of the land. And the few people who are rich, Boehner, Cantor, and I believe Michelle Bachmann, are telling these poor, ignorant Republicans who should be celebrating that there is a good health care. Now, what is the problem with giving kids or women who do not make enough money in this country free health system? Health issue is a moral issue.
And following up on his comment, this particular motion to recommit would add back into the bill, would preserve the benefits of the Affordable Care Act for women and children by excluding from repeal a number of elements in the law. Here's Mark in Hempstead, Texas. He's on our Democrats line.
You know, I think that this is just one opportunity for Republicans to get on the House floor and to grandstand and bloviate about all the things that we voted for in last November. We voted to re-elect President Obama. We voted to represent the liberal agenda, which they have so much problems with. I think that it's important that everybody understand that this is America. And in America, we should have the gall to want to support and help people who are less fortunate, the poor and downtrodden, the people who can't afford to go to hospitals. So we're in the now over 30 votes, and we're still voting on repealing something that was enacted years ago. I mean, get over it. Move forward.
Here's Lou in Evans, Georgia. He's a Republican caller. Hello there. Lou in Georgia. Evans,
Hello.
Georgia. Hi, Lou. Go ahead.
Yes, sir. I'm for appealing Obamacare. People that has always gotten food stamps and been on insurance furnished by the government, if they want a job, they can get a job, and they can save and for the future, because where there's will, there's a way. There's no free lunches, only through the government.
Checking some of the comments on Twitter, we're keeping an eye on the hashtag healthcare, but earlier in the day, the hashtag Obamacare in 3 words was tweeted out not only by the White House, but by other politicians and just folks on Twitter. The White House earlier today tweeted out, "It's the law, Obamacare in 3 words," to which the Speaker's office retweeted "arrogance of power," and a whole bunch of responses on that particular hashtag. Steny Hoyer saying quality, affordable care. Eric Cantor's office, Obamacare in 3 words, $1 trillion in taxes. Let's go next to Fairview Heights, and this is Fran on our independent line. Hi there.
Yes, sir. I'm all for repealing this health care because this country is going to go down the tubes if we continue on this route. And why would the Democrats cram this down our throat when Congress and Senate and Obama will not have this same health care? He wouldn't even answer that question when he was on Good Morning America or whichever one it was. Never did answer if he was going to have Obamacare himself. Now, my husband's a railroad man. I get a letter from my health care hospital and medical group. They're now going to drop me because they're not being paid enough. I thought we weren't going to lose our doctors.
So you can't pay more and stay on your husband's plan?
With the insurance I have, if they don't agree, come July 1st, I cannot go to that hospital.
Fran, thanks for your call. Just a few seconds left in the vote, but still a number of members, some 200 or so left to vote. We'll continue with calls. A quick check of our poll on Facebook, facebook.com/cspan, asking you, do you support or oppose repealing the law, the 2010 health care law? So far, 367 in favor of repealing the law, 265 against. Oakland, California. Ben, good evening, Democratic caller.
Good evening there. I'm, a lifelong Democrat, and I guess that's the difference between me and the Republicans here is that I do see a role for government when there's something that is such a simple and social need across this country that people, as a part of their lives, need health care. There is a role for government when what has happened in the past is simply that the people who are well off, the people who do have money, have created a system that was locking everyone else out. And I believe that what's happening with the rise in rates is simply insurance companies trying to get greedy and force the issue publicly by raising their rates, and it has nothing to do with Obamacare. They're just trying to stir the pot and make everyone give their Republican friends some kind of other kind of cover to try and go through with this process that's simply, not going to work.
Next up is our Republican line, Memphis, Nebraska. Stephen, hi there. Oh, I'm sorry, I got the wrong one. Stand by, Stephen. Here we go. Stephen in Nebraska, are you there?
Yeah, how you doing?
Hi.
I used to be for Obama before he actually got elected into office. I thought it might be good to the change of America. But then I realized after a while that I'm glad I never did vote. For the simple fact is it seems like everything he said, is going the opposite direction like they've said before on the calls. I'm a younger guy, but at the same time, I know better and I see what's going on with like the healthcare thing. Nowadays, if you go into the hospital and you don't even have insurance, it's like they give you the bottom of the barrel room, the service, and the treatment.
Sounds like you had some experience with this, have you?
Oh yeah, I've had quite a few experience. We came up from paycheck to paycheck. My dad raised all three of his kids since I was an infant, and I'm the youngest. And living paycheck to paycheck, you don't have all the qualities of life, and you deal with what you got. And when you hit 19, they kick you off of it and let you apply through yourself or whatnot. And it's just they treat you like you're just, scum, and as soon as you tell them you ain't got insurance, it's like they just don't care to even try to treat you. They tell you, oh, it's just a virus, you'll get over it, and if you do have insurance, then you get glass sliding doors, rooms, all the new electronics and all that stuff. You get seen every 5 seconds, but otherwise it's just like they just don't even care to bother with you.
How old are you now, Stephen?
I'm going to be 23 September 3rd.
Thanks for checking in and following the debate here on C-SPAN. House is voting on the motion to recommit ahead of the final passage vote on repealing the 2010 health care law. Again, this is the third attempt to repeal the entire statute. One was made in 2011 and then again in 2012, last summer, following the Supreme Court decision. Mesa, Arizona, Independent Line. This is Deborah.
Hi. I've done a lot of research on the health. I tried to read the bill like I do many bills before they go, so I can tell my representative how I'd like them to vote. I was unable to even get through 318 pages, and that was when it first came out. I found that a lot of the added pages to it are still, unless you have a degree, a legal degree, are unable to even determine what it really says. And so I do hope they appeal it, only because I don't believe that any of them that are up there have really read what it all contains, and obviously they're having troubles implementing it. So if something is there that much trouble found in it, it would seem logical to me to appeal it. And not that I don't want something to happen with health care reform. I would love that, but how this happened and the process it's going through, it's causing so much division in our country. It's causing so much division. Everything in our government right now is causing so much division, and people call names and point fingers, and it's just from their ignorance, because I don't believe that there's a lot of people that even take the time to read bills.
That's Deborah in Mesa, Arizona. Another Deborah here, this time on our Democrats line, to Watertown, New York. Hi there.
Hi, I was calling. I wanted to give a life point of view, which actually happened to me, that I hope maybe, somebody will actually think about this with this Health Care Act. I lived in Texas under Governor Perry, and unfortunately, during the 2008-2009, when we had the financial crisis, I lost my job. Well, during that time, I could not afford the COBRA, and in 2009, I started getting sick. In 2010, I winded up having a heart problem, and I winded up having astronomical hospital bills. I had no insurance. So I winded up in bankruptcy. Even after that, I tried to get disability. I tried to get help with medical. I couldn't get any help at all. My daughter was in the state of New York, and she said, "Mom, come here." She said, I know that we can get you help here.
So you moved from Texas to Watertown because of that?
Exactly.
To New York. Deborah, thanks for sharing your story. We're going to get a couple more calls if we can here as the vote winds down. Lucette is in, Joyce is in Munfordville, Kansas. She's a Republican caller. Hi, Joyce.
Hi. How are you?
Doing fine. What do you have to say about the proposed repeal of the health care law?
I would like to repeal it. I can't understand what they're even thinking about, I don't, let me say this, I don't vote. I do vote, I'm registered Republican.
Mm-hmm.
But if I have a Democrat that's in there that I think that is a better man than the Republican, I will vote that if I can. And I don't like the way it was put in there. It was put in behind closed doors. And like many of the other people have said, you don't even know what you voted on.
Joyce, we're going to let you go right there. Thank you for your call and all the calls this afternoon. As the vote begins to wind down, again, this is the motion to recommit, a last chance to change the bill before the final passage vote, which is next. The conversation and the poll question continues online. Do you favor, support, or oppose the repeal of the 2010 health care law? That's at facebook.com/cspan.
On this vote,
Mr. Murphy of Florida. Mr. Murphy of Florida votes aye.
on this vote, the ayes are 190, the nays are 230. The motion is not adopted. The question is on the passage of the bill. Those in favor will say aye. Those opposed will say no. The ayes have it.
Speaker.
What purpose does the gentleman from New Jersey seek recognition?
On that, I ask for the yeas and nays.
The yeas and nays are requested. Those favoring a vote by the yeas and nays will rise. A sufficient number having risen, the yeas and nays are ordered. Members will record their vote by electronic device. This will be a 5-minute vote.
It's the final passage vote on the repealing the 2010 health care law, the third attempt by House Republicans to overturn the 2010 Affordable Care Act. CQ wrote earlier today that Speaker Boehner said the 70 new House Republicans asked for a chance to go on the record about the law, but they write the proceedings are more about reassuring outside conservative groups that the GOP is focused on dismantling the law, not trying to fix problematic sections or striking unpopular provisions. The vote on the bill by Michelle Bachmann is entirely symbolic, writes CQ, because the Democratic Senate won't touch the measure and Obama would veto if it ever reached his desk. It's a 5-minute vote. Final passage.
29, and the nays are 195. The bill is passed. Objection, a motion to reconsider is laid on the table. For what purpose does the gentleman from North Carolina seek recognition?
Speaker, I ask unanimous consent that I might remove my name from H.R. 107 as a co-sponsor.
Without objection, so ordered.
Thank you.
The chair announces the Speaker's appointment pursuant to 22 U.S.C. 276L and the order of the House of January 3, 2013 of the following member on the part of the House to the British American Interparliamentary Group.
Mr. Cicilline of Rhode Island.
The chair announces the Speaker's appointment pursuant to 22 U.S.C. 6913 and the order of the House of January 3, 2013 of the following members on the part of the House to the Congressional Executive Commission on the People's Republic of China.
Mr. Wolf of Virginia, Mr. Pittenger of North Carolina, Mr. Meadows of North Carolina.
The chair lays before the House the following personal requests.
Leaves of absence requested for Mr. Sam Johnson of Texas for today and for the balance of the week, and Mrs. Wagner of Missouri for today and for the balance of the week.
Without objection, the requests are granted. We need order in the House. The chair will now entertain requests for 1-minute speeches. For what purpose does the gentlewoman from Florida rise? Without objection, the gentlewoman is recognized for 1 minute.
Thank you, Mr. Speaker. I rise today to congratulate Cipriano Garza, who this Saturday will be joining the ranks of a selected few on the South Dade High School's Alumni Hall of Fame. Throughout his life, Cip, as he is known, has achieved high levels of personal success and excelled in his profession, making him a great example of the diversity and ingenuity of the South Florida community. During his senior year at South Dade High, Cip set new state and school records for the 100-yard dash at the state championships while crossing the finish line barefoot. As a son of migrant farm workers, Cip has used his unique perspective in working with Dade County Public Schools to create innovative educational programs and eradicate the school dropout rate among children of migrant farm workers. In 1993, after being appointed a special assistant to the Secretary of the Department of Housing and Urban Development, Cip became the first Mexican-American to receive a presidential appointment in the state of Florida. Cip's many accomplishments and dedication to the betterment of the community make him deserving of this great honor. Congratulations to Cip Garza. Thank you, Mr. Speaker.
The gentlewoman yields back. For what purpose does the gentleman from Texas rise? Without objection, the gentleman is recognized for 1 minute.
Mr. Speaker, today for the 37th time, the Republicans set a vote to repeal the Affordable Health Care Act.
Yet again, this is a waste of time and taxpayers' resources on pure political posturing rather than working hard on behalf of hardworking American taxpayers. As a freshman member, I can tell you where I stand, and that is in 100% pure, full support of the Affordable Health Care Act. Republicans have ignored real problems affecting our country and instead have chosen to attack the poor and most vulnerable. Millions of Americans are already enjoying protections and benefits under the law. In my state of Texas, over 300,000 young adults are able to stay under their parents' plan. Over 3 million women and 1.8 million senior citizens have access to preventive care. Many more will have insurance coverage once the insurance exchanges are in place for 2014. Republicans constantly talk about requiring more efficiency and reducing redundancy in federal government. How about we start reducing redundancy right here in Congress? Let's move beyond messaging bills and into actual substantive legislation. Let's focus on jobs and grow the economy rather than wasting money on repealing the Affordable Health Care Act. Thank you, Mr. Speaker.
The gentleman yields back. For what purpose does the gentleman from Pennsylvania seek recognition?
Mr. Speaker, request unanimous consent to address the House for 1 minute, revise and extend.
Without objection, the gentleman is recognized for 1 minute.
Mr. Speaker, Americans want and need greater access to health care, and they deserve reforms that will lower costs and expand access, but without undermining quality and innovation. These were the promises of the President's health care reform law. These were worthy goals. Unfortunately, they are not reality. To the contrary, over the past 3 years, families and businesses